Tokyo Live Endoscopy 1.
Welcome to the Legend of Endoscopy Award ceremony. For this special session, we would like to acknowledge a renowned endoscopist with the Legend of Endoscopy Award. To present the award, please welcome Professor Haruhiro Inoue. Professor Inoue, please.
So thank you very much, Dr. Raina Fujiyoshi, for your introduction to me. It's really my great honor to present the Legend of Endoscopy Award to Professor Robert Hawes to his exceptional contribution to GI endoscopy, particularly ERCP and the US, especially focusing on interventional US and nodes.
Thank you very much, Professor Inoue. Now, may we please have the introduction video of this year's Legend of Endoscopy awardee.
Well, it's again a very great pleasure for me to be here. This is a very special moment for me, and I very much appreciate the chance to be with you and to demonstrate in Japan. This is very comfortable for me because number one, the setup is very good, but also I have around me a fantastic group of both friends as well as colleagues. So Dr. Itoi and Dr. Sievald and Dr. Ryosawa and Anna is with me, and so I think this will be successful for sure. One principle for ERCP for me is to study the papilla, to not just begin cannulating, but to study the papilla. You will see, number one, that there is a periampullary diverticulum up here. And so when there is a periampullary diverticulum, you must figure out what is the trajectory, what is the direction of the bile duct. And I think that you can see here that the bile duct is going in this direction. My preference is to at least try with the wire-guided technique. So I'll ask Anna to advance the wire just a little bit. And then, again, cannulation is not an aggressive maneuver. It should be a soft maneuver. It should be something that you do gently. Cannulation never depends upon pushing harder. It always depends upon being in the right direction.
Congratulations, Rob.
And so, it was a very difficult cannulation, but I was lucky. Is it possible that there is no stone there? Itoi, is it possible?
Spontaneous?
Maybe down.
I am very good, Itoi, but I am not that good to make the stone disappear by magic. I don't know.
Are you magician?
More.
But before I do a balloon dilation, maybe the stone is gone.
Yeah, I guess so. I guess so.
So I think I would like to demonstrate spyglass, if it's okay.
Okay.
Okay. So what I do is I control the spyglass as if it's a catheter. So I've got it sort of curved in a natural cannulation position. And now I can use my elevator. It's a very robust instrument, so I'll use my elevator, come up on my up-down, and now I'm in the bile duct. And I'm sucking out all the contrast. I want to keep the bile duct decompressed, okay?
Maybe it's...
So no stone yet.
Yeah, it's left.
You think it's gone?
Not right.
Yeah, so... I mean, this is just very unusual. This was a 15 millimeter or 2 centimeter stone, some people said, and you know, to have this migrate out is so unusual for
Yeah,
me.
unusual.
A special Japanese secret, I think. But she has done very well to extract the stone herself. Okay. Well, thank you very much. I'm sorry that we didn't get to show the EHL, but at least we got to show the spyglass. Thank you.
Very good.
Thank you very much.
Thank you very much.
Congratulations.
Dr. Robert Hawes was born in 1954 in Berkeley, California. From a young age, he has always dreamt of becoming a doctor. In 1976, he joined Indiana University to pursue medicine, where he also completed his medical residency and gastroenterology fellowship. He then pursued an advanced endoscopy fellowship in London, focusing on ERCP and endoscopic laser therapy under the direction of Peter Cotton and Steve Brown, respectively. After being introduced to endoscopic ultrasound at the Middlesex Hospital, he established the EUS program at Indiana University in 1987, which was one of the first 5 training centers in the US. He continued his work in pancreatobiliary endoscopy and established a multimodality treatment center for the non-operative management of gallstones. After moving to the Medical University of South Carolina in Charleston, Dr. Hawes instituted a new digestive disease center, along with his longtime friend and colleague, Dr. Peter Cotton. Designed to facilitate the integration of GI medicine, surgery, and radiology into an integrated unit to promote patient care, research, and technology development to treat patients with digestive diseases. This new digestive disease center has become recognized nationally and internationally for excellence in EUS, ERCP, and therapeutic endoscopy. With his passion in creating a close collaboration between therapeutic endoscopists and minimally invasive surgeons, the joint ASGE SAGES Committee was formed, becoming responsible for developing a new paradigm in minimally invasive surgery called NOTES, Natural Orifice Transluminal Endoscopic Surgery.
We control the position of the region, full section, full endoscopic section.
Okay, closed loop?
Yeah, close, rapid loop. Blue one. Okay, you can see the bottom, you can see the surface of the inner circular muscle layer of the esophagus.
Dr. Hawes is one of the most open-minded endoscopists, always acting as a globalist. He has contributed enormously to develop and establish EUS. One of his best endeavors is educating other endoscopists through lectures, hands-on training, and live demonstrations throughout Europe, Asia, and the Americas. With a vast number of peer-reviewed articles, book chapters, and recognitions, Robert Hawes has indeed become a household name in the world of endoscopy. Dr. Robert Hawes. We honor and salute you for your invaluable role and innovations in the field of endoscopy. We love you.
Any other comments? No, perfect. Okay. Anyway, I think that's
Thank
it.
you.
Any questions?
Any questions from the floor? Any questions?
And to have a
or
good
any comments?
assistance. This is
Yes.
also very important.
Okay, thank you very
You
much.
have many good minds, right?
Thank you very much for this informative.
Now, to give their greetings to Dr. Robert Hawes, may we please have Dr. Shyam Varadarajulu and Dr. Horst Neuhaus.
Rob, you are a world-class endoscopist and a wonderful human being with strong ethical and moral values. You are a true legend in endoscopy.
Dear Rob, I congratulate to receive the Legend of Endoscopy Award of Tokyo Life Endoscopy 1. Now, a legend is somebody who is famous and admired because of outstanding abilities. You well deserve this award because you have a variety of abilities on a very high level. You are an outstanding and skillful endoscopist and a great teacher from whom many endoscopists, including myself, always learn a lot. You are innovative, but very careful in applying new technologies to patients. Now, as a researcher, you and your group published a lot to share your data, your knowledge and experience with other clinicians and researchers from around the world. You are a great team player and leader, and you are open-minded and interested in other people at an international level. In spite of your outstanding career, you stayed humble. And as a physician, you're always focused on the best care of patients. Congratulations again, Rob. I'm very proud and happy to be your friend, and I really do hope to meet again in the real world. Enjoy this award. Bye-bye.
I'm delighted to know that Rob Hawes is receiving this year's Legend of Endoscopy Award at the Tokyo Live. Rob is a true icon of endoscopy. He is my real hero. I have known Rob over the last 20 years. He is not only an outstanding endoscopy and a teacher, but an outstanding human being. In fact, his warmth, his humility and concern for others stand out amongst other qualities. Rob, you really deserve this award, and we all love you.
And now, to present the crystal to Dr. Hawes, may we have Professor Inoue once again.
Hey Rob, congratulations.
Thank you very much, Professor Inoue. And now to receive the award and give us his comments, let us all welcome the Legend of Endoscopy Award himself, Dr. Robert Hawes.
Well, I'm not sure what to say. I must admit that I'm incredibly moved by this entire celebration. I think it's somewhat interesting that the award is being presented to me by the person that I regard as the greatest legend in endoscopy, which is Haru. I so appreciate the video that was produced, and I want to very especially thank the production team for putting that video together. It brought back a surge of memories for me throughout my career, and just reminds me of how lucky and fortunate I've been in my career to come in contact with so many amazing individuals. This is my greatest gift that I have received in my profession, is the opportunity that I've had to travel and meet so many skilled and wonderful people. And the video just served as a reminder of all those people. I am a product of my environment, and I think whatever I have contributed to endoscopy is a direct result of the people that have influenced me and given me opportunities to improve and to take care of patients. And this has been the great gift of my career, is the opportunity that all of us have to use our abilities and skills to make patients better. And that's a privilege that I will always cherish. So Haru, to you, my most special friend, thank you for creating this award and awarding it to me. Thank you for the entire team for putting together the video and making this this event happen, and a very sincere hug to all the people in the video, because that represents all the people that have influenced me and my career. So thank you so much, Haru. And as Horst said, I look forward to a time when we can be together and I can see you face to face and we can be in person. And I look forward to that very much. But thank you so much, Haru. I'm humbled and most appreciative. Thank you very, very much.
Thank you very much, Dr. Hawes. And for our closing remarks, Professor Inoue.
Thank you very much, Professor Robert Hawes, for your great contribution to our GI Endoscopy Society. Actually, you are cover the worldwide service to educate young doctors. Of course, you are the leader of the ELCP and the US and the interventional US and the minimally invasive therapy notes, and your contribution is enormous, and we learn a lot. And the mostly appreciated your humanity. So when we are together with you, we are really happy. So stay safe, and also more and more contribute to the society of GI endoscopy and patient. Thank you.
Thank you so much, Haru. Please, everybody, thank you for this huge effort that you've made. And I'm just humbled and grateful and thankful. And please, everybody, stay safe and stay well. And I look forward to seeing everybody in person at some point in the future. Thank you, Haru. Thank you.
Thank you so much.
Okay. Ciao.
Ciao, ciao.
Thank you.